bed support, and if there is a trouble in the whole system, how to troubleshoot. So see, we try to cover all this because we have only 2.5 to 3 hours. So first, I will like to invite Dr. Shishir Kumar Choudhury. Please, Shishir. Shishir practices in Kolkata. Kolkata people know about Dr. Bani Mitra, his clinic, Surgery Center. He's attached over there as fertility specialist. So, Shishir, please start with your presentation first.
Sir, may I start? Yeah. Good afternoon, respected seniors and everyone. So, very warm welcome. Very warm welcome to a post-lunch session. And the first session is pre-IVF checklist. So when patient comes with a complaint of inability to conceive, and so we search for the reason, and to diagnose it, so we can do the correct diagnosis and with the right intervention so that optimum result can be achieved. So those patient couples seeking for the IVF or ART procedure, as a doctor, we must ensure that those couples are well informed, they are well prepared, and they understand the process of ART procedure. So we have checklist both male and female part so that we doesn't miss any pre-IVF workup. So starting with the history, the couple's religion is important, whether they are happy to opt for third-party reproduction. The maternal age has a significant inverse relationship with live birth rate. So, advanced maternal age with poor ovarian reserve may opt for self-egg, so we have to consider dual stimulation to achieve higher oocyte, or couple may opt ovum donation for higher success rate. Whether the couple, both of them are working, they are staying in the same place, or due to job they are staying in separate place. Whether it is a stressful job or the husband is working in a very polluted industrialized zone which is affecting the semen parameter. The married life, whether it is the 32 years female married for 2 years or a 30 years female married for 10 years. So they are seeking, trying for normal conception or seeking fertility treatment elsewhere. Menstrual history is very important, whether she is having a regular cycle or irregular cycle, just like in PCO, whether having heavy menstrual flow in a case of subendometrial polyp or fibroid, or she is having a very scanty flow in a genital tuberculosis, or she is experiencing painful menstruation, giving an indication of adenomyosis or endometriosis. Whether the mother is having a previous OPS history, whether the history of any miscarriage followed by any dilatation, evacuation, whether any chromosomal study has been done, whether there was any cervical encirclage operation were there, or preterm delivery were conducted, a normal vaginal delivery or cesarean section history is important, because this patient, after becoming pregnant, she has to carry this till term and have to deliver a live baby. Previous fertility treatment, the number of IUI cycle, whether it was a self or with donor sperm, number of IVF cycle, if it was with the self, then the number of oocyte, the quality of the oocyte, the quality of the embryo with the previous treatment sheet, it is helpful to decide for the next treatment protocol, whether she was experiencing a recurrent implantation failure or recurrent miscarriages. So, first of all, the medical evaluation. Review the medical history of both partners and conduct a thorough physical examination. Ensure that any underlying medical condition such as diabetes, hypertension or thyroid disorder are well managed. Surgical history for the male part, orchidectomy, vasectomy, hydrocele, varicocele, hernial repair or FNSA of testes. The patient might give a poor sample or oligospermia sperm. In female part, whether there was a past history of endoscopy, history of polypectomy, myomectomy, endometriosis, the tubal status, whether there was tubal ligation were there, tubal recannulation was tried, or due to hydrosulfing, the tubal clipping has been done. Now, the medication of both partners are currently taking and make necessary adjustment to those that may interfere with fertility or pregnancy. Medication with potential teratogenicity should be reviewed, just like taking valproic acid in epilepsy, and adjusted in collaboration with the prescribing healthcare provider. The lowest effective dose of the safest medication should be used whenever it is medically reasonable to do so. Male partners should be screened for the use of androgen such as testosterone, because it is associated with azoospermia or infertility, which may be reversible in some cases with sedation. Advise the patient to adopt a healthy lifestyle, including maintaining a balanced diet and regular exercise. Females should avoid smoking because it increases the risk of conception delay and for primary and secondary infertility. There is no direct evidence between the smoking and sperm quality. Females should stop alcohol consumption because it may decrease chances of successful live birth. And males should stop alcohol 1 week before they provide a semen sample for IVF. Discuss the importance of a healthy body mass index for both partners, because higher body mass index may affect the oocyte and semen quality. Regular physical exercise improves cardiovascular health, reduces obesity and associated medical comorbidities, and improves longevity. So, patients should have exercise moderately at least 30 minutes a day or 5 days a week for a minimum 150 minutes of moderate exercise per week. This level of exercise are recommended during pre-pregnancy, during pregnancy or in postpartum women. Dietary modification in concert with exercise produce greater weight loss than exercise alone. Discuss the impact of stress and ways to manage it, such as yoga, relaxation technique, meditation, and other reduction strategies. Encourage both partners to avoid exposure to environmental toxin and chemical that may negatively affect fertility. So, reviewing family and genetic history, like any birth defect, mental disorder, breast, ovarian, uterine or colon cancer history. When any genetic disease carrier status is diagnosed in one or both partners, full medical record review and genetic counseling are recommended to educate the patient on the effect of the disease and the potential option for pre-pregnancy and early pregnancy screening of offspring. Couple at risk of having children with specific genetic disease can be counseled about the disease inheritance course and offered referral for potential interventions such as pre-implantation genetic testing. Discuss the importance of folic acid supplementation and other vitamins before conception to reduce the risk of birth defect. Manage any pre-existing conditions such as diabetes, thyroid disorder to ensure they are well controlled before pregnancy. And we can add on DHEA, coenzyme Q in poor responder or antioxidant to male. Screen of sexually transmitted infection and other infections that might affect fertility or pregnancy. Genital tuberculosis should be screened and treated appropriately before pregnancy. And pap smear should be considered in elderly patient. Ensure that both partners are up to date on immunization, especially rubella and varicella, to prevent potential risk during pregnancy. A single dose of Tdap vaccination is recommended for non-pregnant adult. Routine investigation for both husband and wife, blood group, thalassemia status, fertility testing, assess the ovarian reserve to test like anti-Mullerian hormone, day 3 follicle stimulating hormone, antral follicle count on sonography on day 3, 4 or 5. In some cases, if we have a history of HSG, it is helpful, or we may perform a HSG or saline sonohysterography to evaluate the fallopian tube and uterine cavity. Check for male infertility issue through semen analysis, whether it is a normal parameter or oligospermia or OATS, and other relevant tests like DNA fragmentation test, where there is a previous history of recurrent pregnancy loss, whether female parameters were within normal range. Offer counseling or refer patient to a counselor to assess their emotional readiness for IVF. Address any concern or anxiety they may have about the procedure, especially where third-party reproduction is involved. A detailed breakdown of the cost associated with IVF must be consulted before IVF procedure is started. Ensure the patient understand and sign consent form of IVF, including the risk and potential outcome. The legal and ethical issues, including the disposition of unused embryo or donation of embryo for any research purpose. If needed, discuss the process of sperm retrieval with the male partner, whether if every parameters are normal through ejaculation, or if there is obstructive agiospermia, testicular sperm extraction could be done. The different mode of protocols are there for ovarian stimulation. The process of ovarian stimulation in details should be discussed, the medication involved, and the associated monitoring, including ultrasound and hormonal level. So basically we are having agonist-antagonist cycle, but nowadays most of us are using antagonist cycle. But agonist cycle can be used where there is previous IVF failure are present, mainly in advanced maternal age. Embryo transfer process should be discussed, including the number of embryo, whether single embryo transfer or two embryo transfer. In advanced maternal age, for the high success rate, we may transfer 2 to 3 embryo, but we should explain there is possibility of multiple pregnancy complication. A trial or mock ET in the preceding cycle to record direction of uterus, cervical canal. If there is a presence of false passage, then hysteroscopy may be needed. So we should discuss, when the couple want to proceed, schedule follow-up appointment to monitor the progress of the treatment and adjust the plan as needed. So in conclusion, before starting IVF, a proper history is important because it will give us how to proceed, a healthy lifestyle, a corrected medical condition, and preconception care with add-on where necessary, wherever it is necessary, routine and fertility investigation, a proper counseling and proper consent, the protocol of ovarian stimulation and sperm preparation, whether fresh or frozen embryo transfer. We should discuss with the timeline when to start this IVF procedure and follow-up appointment. Thank you. Thank you, everyone.
Okay. I think you made a good presentation. You covered all aspects of pre-IVF checkup. Any more question from the audience? Dr. Suman, you want to add something, or Amol, you want to add something? Monica, something we need to check before we start our IVF protocol, something he missed?
Suppose we have a previous history of implantation failure, then there we can do error test. I have not written here. So it is important whether the previous we have a previous IVF treatment history.
About era, actually, I think we have disagreement between all of us. I think all of us not very enthusiastic about doing era. Some centers are doing. So yeah, that's an optional test, of course, you can do. Otherwise, Cecil, it was a nice lecture. Any question from the audience? You want to ask anything? Anything you can ask any question. Don't do it. Nobody will think that you are asking a stupid question. Ask any question because you people are beginners or freshers in the field. So ask any question, no problem. Or otherwise, we'll move on to the next speaker. So our next talk will be on stimulation protocols. You know, when IVF started, it started in natural cycles in the initial years. And I think Subhash Mukherjee was first person in India, all over the world, who started stimulation with human menopausal gonadotropin. Although it was not initially recognized, later on he got the recognition. But first IVF baby, Edward Steptoe, it was a natural cycle. But from natural cycle, we have seen that stimulated cycles have much more advantages. So all over the world, we are doing embryo transfer in natural cycles, but we are not doing ovum pickup in natural cycles. We are doing in stimulation cycles. And for a clinician, it's important to know how to stimulate a ovary, because your stimulation protocol, the ultimate target is to get good M2 sites, and your stimulation protocol will give you the optimum number of M2 sites. So for that, I personally chose Dr. Sumanna. Ma'am, CV? Kothay? Play karo, display karo. The thing that she was my senior at AIMS, and she's now an IVF consultant in Bangalore. So, ma'am, CV ta dao. You can see, but one thing I should say, she was my teacher actually, because I did my JRC when she was senior resident, and it was an experience for us because we used to be very scared of her. Not that she scolded us a lot, but she always asked us the pointed questions, the inquisitiveness. कि रहमान ये क्यों हुआ? ये patient काल अगर खराब हुआ तो क्यों हुआ? सोचा है क्यों हुआ? So wherever I went for rounds with Dr. Sumanna, I used to get prepared myself well. कि क्यों ये हुआ? She will ask me, I know why. So ये जिंदगी में बहुत important. It's very important in life to ask yourself, why did this happen? Could I do something extra? That's important for all clinicians. That's what I learned from you, Dr. Sumanna. Thank you for this important teaching. And please, then the stage is all yours.
So in life, the most important thing we need to remember is we always have to be a student. So we should never stop learning, isn't it? So a very good afternoon to everyone. Greetings from Bangalore.